Hello friends, today we'll learn a little bit about osteoarthritis. Arthritis is inflammation between a joint where there is two bone or three joined together and there is a soft tissue called the disc, and it is covered with a tissue called as the meniscus. And now when the two bones come together, close together, the disc gets damaged and there is an inflammation which has been created which creates pain. And you can see over here it's like this, the bone one, and it's for a rough I have taken a knee joint, okay, where three join together and there is a disc in between, okay, which is a very soft tissue, and it's covered by a tissue which is called as the meniscus, and within this layer there is a liquid, and this liquid is synovial fluid. And now this two bones move without friction because of the disc and the liquid which is there. When this joint come towards nearby and the disc get damaged or the meniscus damaged and the liquid comes out, there is a friction which takes place within this joint, and that gives you pain, heat and rigidity. This is called as arthritis. And an osteoarthritis is nothing but it's an inflammation where the compression takes place between two joints. Let me not compare with other arthritis where there are so many. We'll discuss in our few other lectures on what may be the cause of this osteoarthritis. First of all, obesity is the basic cause because the weight comes and falls on the joint and the joints and the bones come together and the disc get damaged off, so that an inflammation starts on. Simultaneously, osteoporosis, you have to know about this terminology. Osteoporosis is nothing but it's degradation or weakened bones where calcium is not properly deposited within the bone. The bone becomes so soft enough and it becomes brittle, and that aggravates this much more, so that when the joint comes together and the disc gets damaged, okay, there is a friction which takes place between two joints, and this friction damages the bone and minor particulates remain within this liquid, and that gives a more friction as such and heat, and also causes swelling, so that this is the cause of pain at position of rheumatoid arthritis. So that weight is one of the basic cause of rheumatoid arthritis. Secondly, the joints have been supported by tissues called as muscles, and these muscles have to be strong enough to hold them together. And when we don't give proper exercise as such for the joint, these muscles become rigid or flaccid, so there is a chance for the joints to come together. So that exercise is the second point which you have to maintain, that everyone have to do exercise regularly to avoid osteoarthritis. Is it so that calcium intake will help with osteoarthritis? Maybe a little bit, not directly, because osteoporosis is one of the cause of osteoarthritis. So what we have to do is we have to keep our joints much more stronger, our bones much more stronger, so that calcium intake will be helping. But be sure that excess of calcium is also dangerous for the body. How? See, our arteries are tubules where blood keeps flowing on, and when we take excess of calcium without proper exercise, there is sedimentation within these arteries also, because the calcium is being carried through the bone, through the blood to the bone, okay, so that these blood vessels which carry the blood, okay, do get calcified, and that itself remain for blockages of the arteries, and it can cause blockages as in heart patients, and even in the lower limbs also it can take place. So that we have to be very careful that calcium have to be checked on, and then we have to go for calcium supplements. Okay, chale, now we'll jump on back again inside osteoporosis, a little bit detailed on how to keep our bones stronger. First, though we give calcium, whether the absorption is proper, we have to take care. For the proper absorption, we need vitamin D. Secondly, vitamin K, vitamin C is highly required. First, when we speak about vitamin D, we get only through the sunlight. Okay, is it through 24 hours of sunlight? Not at all. According to Veda, back again, jump inside. So it is very clearly told that prayers have to be done by early morning and not by morning. Early morning when we do the prayers and look at the sun, and when we do it on, okay, this sun radiation tries to fall all over the body, and this light effect of the sun produces vitamin D. So that it has to be early morning rather than morning. This time normally in our country like India, we have to select it like it's from 6:30 to 7:30. Maybe in winters it's little bit delayed, and in summer it can be a little bit ahead. This is what which we have to take care for vitamin D. And nowadays we are seeing lots and lots of people suffering with vitamin D deficiency, and calcium absorption is interrupted because we people try to get up late as such. Okay, maybe the timing is improper. Like we get up by 7 o'clock and we come out of our house by around about 8 o'clock, which is not good at all. We have to be a little bit early. Secondly, when we see that vitamin K is available lots in green leafy vegetables. And nowadays we are trying to reduce our leafy vegetables. We go for all other vegetables like ashgard or potatoes or tomatoes. But we have to see that every day by noon time, when the sun is above our head, it's the proper position for digestion. So that is the time where we have to have at least 100 to 150 grams of leafy vegetable like spinach. Spinach contains a little bit of calcium, iron, magnesium, zinc, and so many other things. So this will be helping for a little bit of vitamin K, which is highly required. Next, when we go on with vitamin C, which is basically required for cell removal. Dead cell removal is being done only by vitamin C. Vitamin C, when we take, people do take it in a wrong way, that when I take a little bit of vitamin C, it is acidic in nature, and so that it gives me joint pain. That's completely a psychological factor, and it's not going to be so. And vitamin C is containing ascorbic acid, and when it falls inside, it reacts with our acid and it becomes alkaline. And vitamin C helps for purification of our body, increase of our immune system, and simultaneously absorption of calcium within the bone. So that each and every individual have to supplement with vitamin C, like lemon, sweet lemon, musambis, orange, okay, and like citrus fruits like grape and bananas. One of the best will be guava. Okay, it contains excess of vitamin C. These fruits can be added on to increase vitamin C, which will help us. The king of vitamin C is called to be as the Indian gooseberry, that is amla. Back again, it will help, but we have to be particular about the ratio of how much we supplement with. It should be of the proper ratio that a person can take max of 4 lemon. It's not that 4 lemon have to be taken in a day. Max of 4 lemon, that can be split into musambis or oranges or grapes or so and so. Okay, simultaneously, and amla, that is one amla, that is one Indian gooseberry, is more than enough to supplement the vitamin C within our body. And if we don't take vitamin C, simultaneously whatever calcium medicines which we are going to take, it's not going to get absorbed within the bone. Simultaneously, we have to see that exercise is being maintained. Exercise in the sense, all joint movements have to be compulsory given each and every day, maybe morning and evening. And if at all small joint movements, we can do it on direct sunlight early morning. It's the best which a person can do. Simultaneously, calcium can be supplemented with from so many things like even leafy vegetables, and fenugreek is there, that's called as methi, and even jaggery, that is black good, which gives a lot. Till, that is sesame, black sesame contains lots of vitamin, calcium, and simultaneously we see capsicum, bananas, custard apple, guava, all these contain lots and lots of calcium. So that these things have to be supplemented. I'll not prefer for milk as such, because nowadays we are propagating on a vegan diet as such, and cow's milk or a buffalo or a goat's milk may be a little bit dangerous, because few people show with maltose intolerance, and as such milk which we get are not pure form. Okay, all these industrialization have made this milk, that is white revolution, which we call it's really drastically, I will tell, it has come down like anything, and we try to drink poison through milk as such. Okay, because oxytocin is given for cow and buffalo. Okay, and even we can see that so many other additives are added in milk which may not be good for health. So let's jump on. And as such, if we tell that human body it's little bit weaker to absorb or digest cow's milk or any other animal milk other than human milk. So that we have given pretty good of human milk until the age of 1. Later it's very difficult, so that we can jump on inside a thing which is very good, that is soya milk. Soya milk has to be prepared properly and then it can be taken. Then if at all we go for a very good thing that is called as drumstick, okay, which we call it as murunga scientifically. It contains all minerals, all vitamins, and whatever nutrition you require for a day, so that every day one can have even a drumstick fruit as such, or a drumstick seed, or even drumstick flowers, or if at all possible drumstick leaf can be supplemented. If you don't get drumstick leaf, you can take powder form of drumstick and boil it with water and drink it off, which is very good for such minerals. So back again, nuts and grains are helping for the glucosamine which is required for the disc to become strong, so that we can add up with amino acids, okay, like nuts and grains. So that will help for the glucosamine, and very good natural glucosamines are there. It's called to be as gond over here in India. It's a sort of gum form which comes from different herbs, and that can help a lot for glucosamine. Okay, now what are the things which will degenerate our joint? That also which we have to know. First and foremost, sugar is a cause of degeneration. As such, try to avoid white sugar completely. Be away from your daily activity from white sugar. Because for an example, I will tell that take the strongest part of your body, that is the enamel of your tooth. Take one of your tooth and then add 4 to 8 tablespoons of sugar in a glass of water, and then add this tooth in that and keep it for 48 hours, and you see that that gets dissolved or it gets corroded off. Okay, if this tooth can get corroded, how much will it happen for the body? See, I was just talking with one of my dental specialists, and she explained in a beautiful way. The bacteria which are there in the mouth react with the sugar and they grow a lot, and these bacteria create, okay, an acidic nature which corrodes your tooth. It's very interesting that it's really a great sign. So that let me try to avoid sugar as such, which is not good for health. Secondly, we'll go for the present life. It's run with tasty tongue people, and we add lots and lots of this MSG, that is monosodium chloride, that taste maker as such it's called, or brandedly it's called to be as China salt or whatever it is. We add it maybe a pinch, or that is 5 mg within the diet which we prepare. That again, back again, it's going to corrode your bone. What do, you just take of 2 pinches of that salt and keep it in your tongue, and you see within 2 minutes there's an acidic reaction which takes place within your tongue, and your mouth will be ulcerated completely. It has such a corrosive nature, so that try to avoid tastemakers. Simultaneously, we add on with so many other diet, like all sorts of roasted food where carbon content is excess, also prevent the absorption of calcium on your bone. And these food we have to avoid compulsory, so we have a stronger bone as such. So now coming back, once you get osteoarthritis, is it required, if at all a knee joint, is it required for going for a transplant? For example, I've been treating a lady of around about 78 to 80 years when I've been at Gujarat. And she brought her X-ray, and it was completely compressed. It was of the 3rd to 4th stage. So then I told, see, the only position which you can do is go for an operation, ma'am. So she told, see, I do have my time now, and I have a faith on few natural therapies. Why can't you not try on me for maybe 40 to 50 days? So that she came regularly for the treatment for 3 hours a day, and she was doing it for 3 months. And at the last, she told that 0% pain. I was really shocked on. So I told, come on, please bring once again. Can you bring an X-ray? So we compared and we saw that in X-ray, the X-ray was showing complete compression, but she did not have any pain and the mobility was increased. She started moving around about, and it was so interesting. She started treating other people who have been suffering. So that's really interesting. So that pain is not the disease, but we have to treat the disease, not the pain. That you have to mention. Disease is something different and pain is something different. Because of the disease, pain is aggravated, not the pain. The pain, we are suppressing the pain. That's not the proper way which we have to do. Next, if at all we have an osteoarthritis, is it so that we should not walk around about, or we should not climb stairs, or we should not sit down? Completely a mistake which we will do in our life. God has given all these joints to be mobile always, all throughout. Okay, we have to judge when not to give a movement and when to give a movement. We should avoid movement when there is complete compression with lots and lots of inflammation with swelling. So that try to reduce the swelling and then go start with your physiotherapy exercises which is required and start moving slowly. That's much more better, because when we start giving back again the movement, the layers, the end of your joints back again can become smooth enough and the pain will be reduced, but it will take time. You have to be patient to treat that. Simultaneously, we can add so many herbs which are available at home. The first and foremost thing which I will help you with is, by late night, what you have to do, if it's a knee joint, take castor oil, if it's possible virgin castor oil, and just give us very soft massage towards your joint, very very soft massage towards, maybe for 5 to 10 minutes on the joint which is affected, and then take a cloth and dip it in castor oil, squeeze it off, remove the oil, and then wrap it against the joint, then put a polythene paper or something against that. So let this be for around about the whole night for 12 hours. Every day try to do it, it's very good. Simultaneously, you can add certain herbal packs, like you can even use cabbage leaf, little bit with castor oil back again, then slightly put it on the pan so that it's warm in temperature, then apply it on your knee joint and then tie it off. Or back again, you have to keep it for the whole day, which is very simple as such. If at all you are towards any villages or so, you get this leaf, it's acacia leaf. Acacia, it's called to be as acacia, and as such in Hindi we call it to be as akada. Okay, this leaf, back again you have to take it, apply a little bit of castor oil, warm it off, apply it on your knee, tie it for the whole night. It's fantastic result. Morning you will feel that the inflammation is reduced and your movement is increased and the pain is also been reduced as such. Or even you can use, if swelling, to reduce the swelling, you can use Epsom salt, magnesium sulfate, a little bit, put it on with water and then apply it on your knee joint, keep it for a few minutes, and then like 1 hour or so, then you can wash it off, and that will reduce your swelling. And a few others, like when excess of pain is there, what you can do. So pain basically can be relieved by increasing the blood circulation and increasing the nutrient which you are taking with to the local joint. So that wherever pain is there, take mustard. Mustard, you grind it into fine particulates, and then after that mix it with water, make it as a paste, and then apply it at the position where the pain is there for around about 20 minutes, not more than 20 minutes. If you are fair skinned, maybe 15 or 10 minutes. Reduce the temperature, because mustard has it's a real reactor to your skin. The heat of your body will be increased, localized, so that you can keep it for 10, 15 or 20 minutes, but not less than 10 minutes. Then after that you can wash it off. Every day you try to apply once, more than enough to relieve the pain, you to get relief from the pain, rather than taking a painkiller or so. That will help you a lot. Simultaneously, few exercises which you have to maintain, like, okay, you take a towel on, okay, you sit erect and keep your legs stretched forward, and take the rolled towel in down your knee joint, and then press your knee down towards the floor, towards the towel. Hold it, start counting 10 seconds, hold it on, leave it free. Back again, hold it on, leave it free. Do it at least 100 times a day. 100 times is nothing. You can sit on your computer and you can do it on, or you can watch your television and you can do it on, or you can sit with your social get-togethers and you can do it. It's very simple, and just holding that will be helping you first. The second thing which you can do, you sit in a chair, okay, raise one of your leg up from your knee joint, hold it for 10 seconds back again, and then slowly come down. then practice with the other leg. Do it 100 times, which is back again. You can do it at your office itself, and that is going to strengthen your knee joint. These two exercises will strengthen your capsule like anything. Your meniscus will become stronger enough, okay, and your knee joint is going to be preserved so that later operations can be avoided. Because as such, there are so many people who have ended up with the transplant and have started giving complaint after 3 years, back again a pain. The only option is we can give an ice massage. No other treatment can be given, or a painkiller, or maybe back again a transplant, which it's very costly and it's very tedious for the body. So try not to go for operation. Try to do what it's possible by you and take the help of a physiotherapist for your knee joint, which will help you a lot. Simultaneously keep on with your walking so that you don't gain your weight back again. So that while you start walking, when you have an osteoarthritis, try to have a kneecap applied on and then go for walking, okay. And see that you don't wear that kneecap all throughout the day, because the muscles which are working with the knee joint will get flaccid back again, and it's very difficult for us to strengthen it back. So that never ever wear it continuously. Only when you go for a walk or you go for the market or so, you wear your kneecap and then continue the process. And this, if you do it for 90 days continuous, I will tell you will see miraculous changes with your knee joint. Even you can add up with acupuncture or acupressure. I'll teach you a small thing with through acupressure. Okay, later I'll be teaching you on with so many other things. Today I will teach you on your knee. See, these two fingers are the position of your leg as per Sujok acupressure or acupressure, and these two are the hand which is lying off. And when you see the knee joint, it's the second joint of your finger. So that what you have to do, it's left and right. So that what you have to do, just give a soft massage whenever you're free. Just give a soft massage towards this joint, okay. Maybe for around about 5 minutes for a finger, okay. Very softly, don't rub it vigorously. Do it very softly, okay. And you can do it with your left hand, or you can do it with your right hand. It does not matter at all. Or even in your toes, leg toes, you can do the center two toes, you can do it on, and it relieves your pain as such. So that these are the things which I want to tell you people, that it's very simple to treat your knee joint, and today's world is suffering with this a lot. Try to work on and give me the result within 3 months, that is 90 days. Count for 90 days and give me the result. I'll be so happy to listen from you people. And later we'll be coming on with so many other lectures on health regarding, and if at all you love these lectures, try to share with your friends and your family members, and please don't forget to have a subscription done, okay. I'll be with you always. Thank you.